Welcome back to Anatomy Physiology, Chapter 7, Part 2. We left off talking about dwarfism, and there's 200 to 300 different kinds of dwarfism. Most of them are caused from a genetic inheritance or a genetic mutation. This is the most common of the different kinds, and if you look at this word, it looks really big, but A means not. And then chondro has to do with your cartilage or connective tissue, and plastic is flexible. The second most common type of dwarfism is a pituitary dwarfism, where you don't make enough growth hormone. So you have normal proportions, but you're just very small. So this is, some people call these people midgets, and apparently that is considered to be extremely offensive. So it's better to say little people rather than use the word midget. But you can treat this one with growth hormone, and they'll grow to their normal height. This one, your long bones stop growing in childhood. So your torso, from your neck down to your genitals, is about normal. But because the long bones stop growing when you were a child, then you have a child's arms and a child's legs. So they're abnormally short. So this is because of the failure of cartilage growth. So that's the cartilage, no cartilage, leading to this problem. Everyone's bones continue to grow, but as we talked about the epiphyseal plates, they don't grow in length, but they do grow in what we call appositional growth. So at the surface of the bone and on the ends of the bone, you're still going to continue to lay down new layers of calcium and phosphate. So you're going to continually grow in diameter and in thickness. And at the same time you're depositing this inside, you are dissolving away the bone. So in the endosteum, which is the inside where the bone marrow is, the osteoclasts are going to be dissolving away that bone. So the result is you're going to get a larger bone marrow cavity. So you're getting wider bones. And that makes sense because think about, again, when you were a baby versus now when you are over 100 pounds, most of us. So every year you recycle about 10% of your skeleton. So if you're leaning over looking at your computer screen or looking at your iToy, then you can remodel your bone to have curvature in your back. So be aware of that and try to sit carefully. So even though you're young, you don't want to end up looking like an old person hunched over. The older you get, the more of these microfractures you're going to get. And if you look at old people, a lot of times you do see them hunched over. And they've actually fractured their bones and repaired it and remodeled it to where they're permanently bent over. Here's a picture of an older person that's hunched over like that. It does seem odd that you would just keep tearing down and building up and tearing down and building up your bones, especially when you're not growing anymore. And some people stay the same weight for 50 years. They can still wear their prom dress even when they're old and celebrating their 50th wedding anniversary. So why would you need to keep tearing down and building up your bones? Well, you need to maintain homeostasis throughout the body. So the skeleton isn't just taking care of itself and the bones, but it's actually providing calcium in order for the nervous system to function and the muscular system to function. So this is super important. We'll talk about that when we get to the nervous chapter and the muscular chapter. Sometimes we put calcium in places where we really should not put calcium. We talked about In breast cancer, you find calcium deposits in the breast, but you can also have calcification in the lungs, in the brain, in your eyes, muscles, tendons, your arteries. So when they talk about hardening of the arteries, they're not kidding. You're actually laying calcium down. So you are hardening, and you need the arteries to be able to flex and allow the blood to go through. So imagine your garden hose, which is flexible and you can run water through it, and then it hardens so that it is no longer flexible. It's going to crack. So this is not a healthy thing to do. And another thing that's not mentioned on this slide is arthritis. So you're supposed to have connective tissue. You're supposed to have cartilage in between your bones. And if that starts ossifying, if you start putting calcium and phosphorus in those areas, then that's what we call arthritis. And there's different kinds of arthritis. A lot of athletes who've had injuries to their ACL, their elbows, places like that, later on in life, they're going to probably develop arthritis in those areas. So that's very common for people who have sports injuries to have arthritis later on. Sometimes it's bad enough that you have to have hip replacement, knee replacement, so on. So exactly how does an osteoclast dissolve your bone? Well, it introduces hydrochloric acid into the area, which will dissolve the bone. And I don't know if you tried this, but there's carbonic acid in fizzy drinks, like Coke, Pepsi, things like that. And if you put a bone into something that has carbonic acid or an egg, and you take it out, you'll find that the calcium has been dissolved out. And then you're left with the collagen, you're left with connective tissue. So there are enzymes that will eat away that. Let me just put a little plug in here, because a lot of parents, you get so desperate to get your baby down to go to sleep, and you're thinking, what can I do that will make the baby be quiet? And so they give them a bottle of cola, something with carbonic acid in it. And the baby suckles on it and sucks and then gets a mouthful of it and falls asleep. And the acid will actually eat away the teeth that the child is forming. So you never, ever want to put your baby to bed with a mouthful of acid. And we mentioned earlier about putting braces on someone. They call them orthodontic appliances because you can charge more money for them that way. And you are putting pressure on the teeth, and because you're putting the pressure on, the osteoclast will dissolve the jaw or the maxilla and the mandible. You're going to learn those words soon. And then the tooth just scoots over because it's just sitting in a bony pocket. And then the osteoblast fill in behind it to hold the tooth in place. This is why you usually do it when you're young. The word for not having enough calcium is hypocalcemia. So usually this is because of diet or because you're pregnant and your baby is taking your calcium right out of your bloodstream. When we do the unit on the endocrine system, we're going to talk about parathyroid glands and parathyroid hormone. And when they removed people's thyroid gland, they thought, well, we just need to replace the thyroid hormone. And they gave the people thyroid hormone and they died anyway. And then someone looked on the inside surface of the thyroid, and there's 4 little tiny spots or areas, and those are your parathyroids. And so they may be tiny, but they're very mighty, and they're the ones that are going to help you with your calcium concentration. So people who had their thyroid removed because they had a tumor or whatever, they also took away the parathyroids, but didn't know to replace that hormone, the parathyroid hormone. So you end up with your nervous system unable to perform correctly. You're starting to have muscle spasms and a laryngeospasm. This is your voice box. If you close off the passageway for air, you can actually suffocate. So this is how the people would die from hypocalcemia. Now, generally, what you'll do is you'll send the message to the bones that you need some calcium to be released. That's what happens when you're pregnant. That's what happens when you're making milk for your baby. But if the parathyroids are gone, nobody's listening. So the message is not received, and you don't dissolve the calcium and put it in your bloodstream. So other things that can cause you to have hypocalcemia is not having enough vitamin D. So you get vitamin D from going outside in the sunshine. Your skin actually can take cholesterol and turn it into vitamin D. So it's really important to get a lot of sunshine. So people who sit inside all the time often are vitamin D deficient. Now in America, we've started adding vitamin D to a lot of our foods. For example, milk is grade A pasteurized vitamin D milk. But then there's been a movement afoot saying, oh, no, milk is horrible, milk is terrible, you need to have almond milk or something. So we're seeing a lot more people with vitamin D deficiency because they're not getting it in their milk anymore. If you have chronic diarrhea, there are certain conditions that cause you to not make a good fecal mass. And so a lot of the water goes out of your body and the calcium can go with it. So these are some of the things that can cause you to be hypocalcemic or have hypocalcemia. Now I'm putting this picture in here because this is what happens if you get too much vitamin D. So a lot of people are taking multivitamins, and then they're taking vitamin D supplement on top of that, and then they're eating foods that are vitamin D enriched. So they end up getting too much vitamin D. So there is too much of a good thing. In fact, there are 4 fat-soluble vitamins that can be toxic if you get too much of them. And they're easy for me to remember because my last name is Drake, D-R-A-K-E. And if you get too much vitamin D, it's going to cause something like this. There is no vitamin R, but there's a vitamin A and K and E. And those are the 4 fat-soluble vitamins. You want to be careful and look at any vitamin supplements you take and make sure you don't double up on any of those 4 because they will store up in your fat and you can get a toxic dose of them. The other vitamins like C and B, they're water soluble, and if you get too much of them, you just pee them out. You just get rid of them through your urine so you don't have to worry about it. So I just thought I'd throw that in because that's kind of important. So what happened here is they're actually putting bone material in between the fingers, the carpals and metacarpals, the palm. It's fairly common to be hypocalcemic, not have enough calcium in your bloodstream, but it's rare to have too much hypercalcemia. So that's what you have too much. So again, calcium is important for your brain and your nerves and your muscles. So you're going to have muscle weakness, you're going to have possible emotional disturbances, your reflexes are going to be very slow, and if you keep on having too much calcium in your bloodstream, you can actually have a heart attack. So, but luckily it rarely occurs, and it's easy to fix. Just cut some of the calcium out of your diet or find out if you have some genetic condition going on. There is a condition called Paget's disease, and we talked about the remodeling where you have the osteoclast and the osteoblast and they're remodeling the bone. Sometimes if you have this disease, you can't remodel correctly. So normally this is what a normal skull would look like, and this is what somebody who has Paget's. So they're not doing a very good job of remodeling. The bones can become too thin in some places, too thick in some places. So it's misshapen. It usually happens in your pelvis, your skull, your spine, and your legs. So these are your flat bones, right there. And the legs would be probably in a younger person. You have 3 hormones that control the amount of calcium that's in your bloodstream. And we've already talked a little bit about the parathyroid hormone, and we'll revisit that when we get to the endocrine system. We'll revisit these again. So a lot of times you're going to find that hormones have a point, counterpoint, an opposite. So, for example, everyone knows about insulin, but a lot of people don't know that you have glucagon. Insulin causes you to pull sugar out of the bloodstream and store it in the liver and the muscles. In the case of too much, that's what you're going to do. But what if you don't have enough sugar? Then you have glucagon, and it takes the sugar out of the muscles and out of the liver and puts it back in the bloodstream. So when we're talking about calcium, we have the parathyroid hormone, which is going to put the calcium back in your bloodstream, and calcitonin, which will take it out and store it in the bones. If I'm ever going too quickly for you guys, and I'm talking about things, or I say, well, we'll talk about that later in another chapter, and you're curious at that particular point in time, you can always use your search engine. For example, here's a place where they have a series of answers, like how does calcitonin work? How does it work? Well, it's going to stop the osteoclast from dissolving the bone. So you're going to leave the calcium in the bone, and the result is you're not going to have as much calcium in your bloodstream. So obviously calcitonin is really important. The parathyroid hormone, remember, that's the one that's going to tell them to dissolve the bone and put the calcium out there. So it works in opposition, so to maintain homeostasis. So what does calcitriol do? That's the third one that they talked about. Well, it is just another name for vitamin D. But we're going to find out when we talk about metabolic processes that a lot of things are active in a different form. So you start out with one form and you activate it by cutting a piece off, adding a methyl group, taking off a methyl group, adding a phosphate, so you can actually activate it. So this is the active form of vitamin D. This is kind of an overview of what we were talking about. I don't expect you to remember these numbers, but you need to eat at least 1,000 milligrams a day. And this is because you lose about 350 in your feces, and you lose about 650 in your urine. Here's a good place to point something out. So 1,000 milligrams is a gram, and because we live in America, we don't have a grasp, usually, of the metric system very well. So what I do to help students understand is I say a gram is about the size of a man's shirt button. So if you can see a man's shirt and take one of the buttons off, that's about a gram. Another interesting fact that is a little bit more disgusting is if you take a wet wipe, one of those that you're not supposed to flush down the toilet, and after you think you've wiped, after you have a bowel movement, you can take the wet wipe and wipe yourself again, and you'll usually get off about a gram of feces that you missed with dry toilet paper. When you're looking at this picture and you're thinking about all the things that are going on, how the digestive tract is absorbing calcium, how the calcium is coming out of the digestive tract and going into the bones, which hormones do it, which ones take it out of the bone, put it in the bloodstream, how the kidneys work and put it in the bloodstream, how the kidneys filter out extra calcium so that you get rid of the extra calcium. We don't even have to think about it. Our bodies are wondrously made, and they figure this out. Most of us don't have any problem with this. So while in our brain trying to figure it out, looking at this picture, what all's going on, who's doing what, where, your body's just naturally doing it. The only important thing on this particular slide that I want you to know is that this is just a form of vitamin D. And here's a second reminder that without enough vitamin D, you will not be able to put calcium in your bones. And so instead of having nice, sturdy bones made of calcium and phosphorus, your bones will mostly be cartilage, and it will give. It's rubbery, because I call it gristle. So basically you're reverting your bones, turning them into gristle so that they can bow. If you have it as a child, we call it rickets. And if you are an adult, osteomalacia. It's interesting that the yin and the yang of the calcitonin and the parathyroid hormone both take place in the thyroid. So the thyroid is the one that's going to make the calcitonin, and the parathyroids, which are actually embedded in the thyroid gland, are the ones that are going to make the parathyroid hormone. So if you have calcitonin, if you get plenty of calcium in your prenatal vitamins, then you're not as likely to dissolve away your bones when you're pregnant. So here's your voice box right there. And here's the thyroid right there. And if you were to take it off like you take off a bow tie and flip it over, there are the parathyroids. Those 4 little spots. We've spent a lot of time talking about calcium because it makes up the majority of our bones, but we also need to talk a little bit about phosphorus, because not only do you need phosphorus to build the bones, but you also need it to make DNA, RNA, and then our energy molecule, ATP, has 3 phosphates, so you really need that. And then if you remember back when we talked about the cell membranes and all of the organelles that are made out of lipids, we need phosphates on all of those lipids. So we need quite a bit of phosphorus in our diet. When I was younger and had more energy, I taught middle school. And it's so funny when I have one of my students from the past who comes up to me and they're so excited. And they go, Miss Drake, do you remember me? And I'm looking at this tall, slender, human, adult. And I don't remember what they look like when they were in middle school. A lot of times you're chubby, you're short, you got little squeaky voices, and they're so hurt. And I say, oh my goodness, you have changed so much. You are so gorgeous or handsome now. And that usually mollifies them. One of the things that happens as you grow older is you stop making a lot of your hormones. So your growth factors, your growth hormones, your estrogen, women go through menopause, you stop making as much testosterone. So all the things that you had in abundance when you were going through puberty and you were shooting up, going from that little short fat kid to a tall slender adult, it's gone. And so what caused you to grow and be taller now works in the opposite direction. And so you'll notice that a lot of old people shrink. So I used to be 5 foot 5 inches, And due to osteoporosis, due to hormone loss, I'm now 5'2". So I've lost 3 inches in height as I've gotten older. Now that's rather extreme and it's not healthy. So I'm kind of on a crusade to help educate people about just because you stop making something does not mean it's normal and does not mean it's healthy. So we figured this out with insulin. If you stop making insulin, that's not normal and that's not healthy. So they give you insulin replacement. And if you stop having your thyroid working, then they say, oh, okay, you need a certain amount of thyroid hormone. Therefore, we will give you thyroid hormone replacement. But someone somewhere published a paper that says if you take estrogen past menopause, it will give you breast cancer. And I have defied people over the years. I said, you go find that paper. You go find that paper and show it to me. Well, no, they don't know, but they just heard it. They just heard it somewhere. So I went on to the cancer National Cancer website and looked. And actually, estrogen will protect you from breast cancer. So they've got it completely backwards. But because someone somewhere published a paper, it's still in the textbook, it's still in the curriculum for the doctors. And so it takes an act of Congress to get them to give you estrogen or testosterone. And in fact, they're so adamant that they won't give you those. They've actually got it scheduled like a narcotic, and you have to have a special license, and you have to go through a special process, and you have to show your driver's license, and they'll only give you a few pills at a time. So, but at least a few doctors are starting to wake up and go, hey, wait a minute. Maybe you do need hormones after the age of 50 or 60. Thank goodness. Girls tend to go through puberty and grow more quickly. We grow faster than boys do. We reach our full height earlier than guys do. And they think this is because estrogen has a stronger effect than testosterone on bone growth. But males grow for a longer time, and they generally grow taller than females. If you take steroids, this is one of the things that's a little bit scary because you can bulk up, you can make your muscles bigger if you take steroids. And if you look at Arnold Schwarzenegger, he admitted to taking steroids. He said, that's how I got my muscles so that I could be, compete in these championships. But if you take large amounts of steroids before your epiphyseal plate has closed, it will close it for you, and it can cause you to be abnormally short. So it's not worth it for the muscle mass to interfere with puberty. So some of the coaches, unfortunately, are so gung-ho on winning the state championships in whatever sport that they're coaching that they encourage their high school kids to take anabolic steroids. So don't do it. And if you find out that your child is doing it, stop them. And if you find out a coach is recommending it, report them. So now we're going to talk about some more bone diseases that you can get, and we're going to look at fracturing. What happens when you break a bone? There's a genetic form of arthritis called rheumatoid arthritis. And in this one, your body actually attacks itself. This is an autoimmune condition. And you're going to have these nodules. So this is inflamed tissue right there. And the ligaments holding the bones together become stretched out, allowing the bones to slip over and out of position. Your skin becomes very thin because you're stretching it with these nodules. So it is extremely painful, but knowing that it's autoimmune, we now have medicines that you can take if you start having a flare-up that will quiet those cells that are attacking you. We'll talk more about autoimmune conditions when we get into the chapter on the immune system. So normally your immune system makes antibodies and it goes and kills bacteria and viruses for you. But occasionally it gets confused and it mistakes part of your body for something else. And so it starts destroying it because it thinks it's a foreign invader. Even though the name for someone who treats bone disorders is orthopedics, it's not just children. This word PED is child. So these are children's bone problems. But older people have, unfortunately, artificial hips, artificial knees, and athletic injuries. So it's not just kids, but it got its name because you usually catch a lot of these bone problems early on in kids, like scoliosis, rickets, things like that, or lack of growth hormone. I'm sure you know an older person who has fallen and broken their hip, but generally that's not the way of it. What really happened was that joint that holds the ball in the socket of the hip is dissolved away, and so the bone breaks. And when your bone breaks, you no longer have that ball and socket holding you up, and so you fall over. So that's generally the way of it. Your bone breaks, causing you to fall, not the other way around. So here's a picture showing that. Here's a normal bone. There's the epiphyseal line, because this is an older person and this is sealed off. But if you have osteoporosis, you do not lay down enough of the spongy bone in there. So it becomes very easy to break. And it thins. Look how thin that is. Look how little bone there is. There's this little bit here and a little of the trabecula and a little bit over here. So it's very easy to break right there. So interestingly enough, when they do a hip replacement, so there's the broken bone right there and the ball has come off of the head of the femur, and they take this appliance and hammer it down into the center of the bone. So that's kind of freaky watching somebody hammer in a new head that'll fit in this socket. Here's a few more pictures of osteoporosis. You can see that the vertebrae are dissolving, and you can see that the discs are slipping. And this is what the hip looks like. You've got holes, literally holes in it, because you're dissolving it away. Now, how in the world people can say this is normal, and that just normally people have osteoporosis when they get older? They don't need hormone replacement. Just, I'm mystified and horrified. The only thing I can figure is they're young and they can't imagine having their bones give way and dissolve. All right, I sound like a broken record, but now that I'm 3 inches shorter, I have a mission to tell other people so they don't have to go through it. So, dissolving away your bones can cause curvature of your spine, and it's rare to get cancer of the bone, but this is an osteosarcoma right there. So it's actually a bone tumor. Now, sometimes you'll get cancer somewhere else and it'll spread to the bones, but to originate in the bones is kind of unusual. We're going to break down broken bones or fractures into a couple of categories. For example, stress fracture versus a pathological fracture. So a stress fracture would be some abnormal trauma to a bone. You fell, or in the case of children, unfortunately, child abuse. Pathological fractures would be the older people because they have weakened bones because of lack of hormones, and people who have cancer. So it tends to break where the cancer is eaten away or caused a tumor to prevent the remodeling of the bone correctly. Osteoporosis obviously is going to cause fractures. So we consider it pathological if it normally would not break a healthy bone. Then we further subdivide the breaks as to whether it broke through the skin or whether it broke in multiple pieces. So if they use the word comminuted, then you know that you've got at least 3 or 4 places where the bone broke. So I believe, again, that a picture's worth 1,000 words. So let's look at some of the different kinds of fractures that you can have. So here's a compression fracture, where you've compressed the spine to where it's actually broken the vertebra. So they have a little arrow there showing you where it's broken. Takes quite a bit of pressure. Look at the size of those bones right there to break one like that. So a compression fracture. Here's a broken elbow. I don't even want to think about that one. That hurts so badly. Right there. Here is a non-displaced. So it broke, but the bones stay in place. So you probably won't even need a cast. You'll just kind of keep pressure off of that area. Try not to use that until it heals back across there. But in the case of this, the bone actually is displaced. So here's a displacement right there. Here's a severe displacement. And in the case of these, you're probably going to have to do surgery and set the bone. So here is where they've taken that and they've had to put braces and screws in, because not only did that bone break, but then you have a tibia and a fibula in this one. Is that right? I thought I had put this picture in the slide, but apparently I put a different one. So there's your ulna and your radius, and both of them are broken. So sometimes you have pairs of bones where both of them get broken. So here's screws set in the tibia and fibula. And let's see, greenstick. Now a greenstick, if you have ever tried to break a branch off of a tree, if it's a dead branch, it just snaps. But if it is a living, healthy branch, then it's going to bend back and forth, and you'll actually see it fraying. You'll see the fibers breaking, but the whole thing kind of stays together. So they call this a green stick because you can actually see fibers, it looks like, of the broken bone hanging down. A lot of times this is from twisting. And this isn't actually a broken bone, but you've actually popped this out of its socket. So you're going to have to pull it up and over and drop it back down in its socket. And apparently it's extremely painful, but once you get it back in its socket, then the pain subsides. So not much fun. I mentioned earlier that the number of bones you have changes over time. So here's a baby's skull, and I think it's kind of funny because here's a baby with no teeth, and here's an old person with no teeth, and their jawbone and their maxilla has actually remodeled to where you can't put teeth in there. The holes where the teeth used to be are now missing, and so it's remodeled and it's smooth. kind of interesting. The other thing is where the baby has the frontal and parietal and temporal bones, an older person has one smooth, remodeled bone. You don't see the suture lines, you don't see the growth plates. It's just smooth. If you watch TV shows like Bones, they talk about things like this. They find a skull out in the forest and they look at it and they go, well, this is from a 70-year-old man, or this is from a child who's only like a year and a half old. In the case of this picture, you're probably talking about a child who hasn't been born yet, because usually most of these plates are almost closed except for the soft spot on the top, the fontanelle. So how do we heal a fracture? Well, you can bleed into the area and it forms a hematoma, which when you see the word oma, it means tumor. But in this case, it's just a huge blood clot right there. And then you're going to slowly replace that with connective tissue. You're going to put new blood vessels into the area. So you're going to grow new blood vessels. And you're going to start putting spongy bone in. You're going to start putting calcium into the fibrocartilage. So you're turning it from a gristly kind of substance into a hardened substance. And then with remodeling, you can remove this area and leave this area. But for some reason, after you've had a break, you'll almost always have extra bone deposited in the area. So it's remodeling in here, but it kind of leaves this one alone. So even 30, 40 years after an accident, when the doctor is feeling for lymph nodes or whatever, they can run across and they go, oh, you broke your collarbone. You go, yep. Because they can feel this bump. They can feel the callus that's left behind after a bone is broken. Ideally, it would be nice if you could put the bones back together without having to do surgery. But sometimes you do have to go and cut. So closed reduction is where you don't have to do surgery. Open reduction, they actually have to open it up and put in some plates or screws or pins to realign the broken pieces. And then oftentimes you'll put a cast on to keep the bone ends from moving, because you want them to make that fragile blood hematoma. So that would be very easy to break if you move the ends of the bones. So here's some pictures of traction. Sometimes you have the whole pulley system attached to the leg and pulling. Here's someone who's got their foot in a stirrup. It looks like a medieval torture instrument. You can do traction on your arms. Generally, you do it on your legs because you have really strong muscles in there, and they're going to be trying to pull that bone apart, and it'll slide over to the side. So if you put traction on it, it'll hold the ends so that they have a chance to heal. So while kids have to lay in bed in traction for a long period of time, old people who have broken their hip, they fix the hip, they put that new ball and socket in there, and away they go. They make you get up, start walking almost immediately. If you have a fracture that just won't heal, then they can treat it with a little bit of electrical stimulation, and it'll get it to heal. There's that picture again that I thought I knew I'd put it in the slide somewhere, but here it is. So this is the ankle. So you've broken the ankle right there, and you broke both bones. So here's a plate that's screwed on, because the fibula is a very delicate bone. whereas the tibia or the shin bone is a lot tougher, a lot bigger. Imagine trying to go through airport security with all that metal in your ankle. They probably think you're carrying a gun down there. It's not uncommon for someone who has broken a bone due to osteoporosis to have a blood clot, that's a thrombosis, or get pneumonia. A surprising number of older people die from a simple broken bone. So that shouldn't kill you. But my grandmother was about 60 when she died from a broken hip. They put her in a nursing home so that she could do rehab and, start walking again. But some of the people in the nursing home decided that they didn't want to keep washing her long hair. She'd never cut it before in her whole life. And so they took the braid that she had wrapped around her head and cut it off. And I think that when they did that, they just took the life out of her. And so we have a saying where you turn your face to the wall. And I think she just turned her face to the wall and she just died. So it's important when someone has a broken bone, especially an older person, to be cheerful, help them, encourage them, tell them they can do this, be a cheerleader for them. Here are 3 spinal deformities. One of them is lordosis, and it is the abnormal curvature down here in your lumbar region. A lot of times it's caused because you're fat and you're trying to balance your body. So you have so much fat here that you have to pull your back out and your hips this way in order to maintain balance. So that's lordosis in the lower back. And kyphosis is often seen in older people. This is where they're bending over and the fractures heal, causing them to bend over like this. So they're permanently in this position. And then scoliosis, you usually see this in kids, where the thoracic vertebra are curved like this in kind of an S shape. And what they'll do is they'll anchor the child under the arms and around the hip and then put pressure to just literally stretch their trunk and pull this straight. They've come a long way in making braces. The older braces look more like an instrument of torture. Here's a child who has scoliosis. They used to check children in school to see if they had scoliosis because you can treat it more easily when a child is growing than after your spine is set, your vertebral column is set. But they've stopped doing it. Here's a few more facts about osteoporosis. Oddly enough, a lot of times they say, well, the Native Americans are more affected by something, or people of color are more affected by things. But in the case of osteoporosis, it's white women who tend to lose their bone mass. So you start losing it as early as 35. You don't wait until you reach menopause at 50 to 60 years old. So you're starting thinning your bones earlier. And by the age of 70, you've lost almost a third of your bone. So you're very susceptible to fractures that wouldn't normally break anyone else's bones. Besides age, smoking also causes you to lose bone mass. If you're diabetic, you lose bone mass. And then, of course, if you don't eat well and you don't go out in the sunshine, then that's also going to do it. But this is just a regular white woman who just takes, eats well, doesn't smoke, doesn't have diabetes, she's still going to lose about a third of her bone mass. And how in the world can you say that that's normal? Anyway, I want to warn people who are really, really into exercising. You don't really think about exercising as being dangerous. In fact, they say exercise, it'll build up your bones, it'll build up your muscles, you'll live longer. And then you'll have these athletes who just fall over dead, and you're like, whoa, they were in the prime of their life, they were physically active, they worked out all the time. Well, they may not have eaten well, and in the case of women, if you exercise too much, you'll actually stop menstruating. You don't even have enough body fat to maintain your hormones. So remember that estrogen and testosterone are made from fat. They're made from cholesterol. So if you don't eat cholesterol and you work out too much, you can't build cholesterol using the fatty acids in your body. So they're finding osteoporosis in especially young women who don't have enough body fat. So if your child is really active and they stop menstruating, that's a warning sign that you need to fix their diet. And I kind of like this picture. Here's the osteoblast building up your bone. Here's the osteoclast tearing down your bone. And they're in equilibrium. Homeostasis is going on. And then you get to osteoporosis, and there's the osteoblast still doing its thing. And the osteoclast is like, I got dynamite. I'm going to blow this up. So it is much more successful at breaking down than the osteoblast can build back up. So while it's somewhat humorous, I'm not laughing. I'm hoping in the next edition of the book that this author will fix this particular statement. It says, yes, if you give someone estrogen replacement therapy, it will slow the bone resorption. But the side effect is the risk of breast cancer, stroke, and heart disease, which is not true, but it persists. They just go from one book and they don't change it, and then they do the next edition and they don't change it in the next edition. So at some point, somebody needs to get this out of the textbooks. There are drugs that you can take, like Fosamax, but I'm not going to say anything because I could get sued, but you should look at the side effects for the drugs that stop your osteoclast. Some people tolerate it great, but the people who don't, the side effects are astounding. You can give parathyroid hormone shots, but you have to do it daily. But if your bones are dissolving and your bones are breaking, then you need to do something. And if you can't find somebody to give you the estrogen replacement and the testosterone replacement, this is a solution, an expensive solution. The best treatment is prevention. So between the ages 25 and 40, if you eat well and exercise, you're less likely to get osteoporosis. And my last picture I'll show you is this is what your bone looks like with osteoporosis.